There's no sort of common or best thing. It's really good for everything. Because, again, being non-diagnostic, we sort of just focus on treating a person at their core and really amplifying their well-being. So it doesn't matter if someone is coming in with knee pain, with back pain, maybe they're depressed, maybe they're, in here working with other practitioners for cancer or for, some kind of autoimmune. It could be anything. Because we're not treating disease, we're working with people and helping them kind of release stress.
Augment wellness.
Yeah, we're augmenting wellness.
Yeah.
Everything can get better.
Welcome back to the Capital Integrative Health Podcast. I am Dr. Andrew Wong, and today we are excited to learn all about zero balancing with our guest, Jared Urchek. Jared is an acupuncturist, zero balancing practitioner, and Reiki Master who helps his clients to improve their wellness by approaching them as a whole person, working on their mind, body, and spirit. In this episode, we explored the fundamental principles of zero balancing, its origins, and how it works to balance the mind-body complex. Jared explains how zero balancing is a powerful tool for healing and personal transformation, helping people of all ages and walks of life to feel more centered, grounded, and connected. We'll also discuss the benefits of zero balancing and how it can be useful for anyone looking to improve their overall well-being, reduce stress and tension, and increase their vitality. So sit back, relax, and enjoy this conversation with Jared on how zero balancing can transform your health. So we're going to discuss today, we're so excited to have you on to discuss zero balancing, or like we like to say, ZB.
Mm-hmm.
And we're so grateful that you recently joined our team as well at Capital Integrative Health, practicing acupuncture and ZB.
Mm-hmm.
So we've already seen a lot of patients get many benefits from acupuncture and zero balancing. I know I just recently had a ZB session with you, which was amazing.
Mm-hmm. Yeah, that was nice to have you have
nice
that before this.
Short session, but really powerful. Before we dive in, let's just kind of go over for our listeners a bit about the work that you do and what drew you to become an acupuncturist and a zero balancing practitioner.
Yeah, sure. So yeah, thanks for having me on. It's been great being here as a practitioner at CIH since December.
Awesome.
So I'm very, very excited to be part of the crew here.
Awesome. So glad to have you.
Yeah. So yeah, I'm an acupuncturist, herbalist, and a zero balancer. And let's see, gosh, what drew me to this work? I think I've always been interested in this kind of stuff. Even when I was in middle school, I was researching meditation and hypnosis, and eventually started studying Reiki really early on. So I've always been drawn to this sort of world, and went to nursing school thinking that was kind of an avenue for me to sort of apply this interest in helping people, and realized that was very much not for me. The hospital system, that whole that whole realm just wasn't quite where I knew I needed to be. I was drawn to Naropa University over in Colorado, Boulder, Colorado.
Boulder, nice.
Yeah, where I could study horticulture and psychology at the same time.
Cool.
Plants and psychology, that's perfectly aligned for my interests. And I was introduced to 5-element acupuncture through there. There was a class on the psychology of the 5 elements, and just blew me away. The poetry, the beauty, the simplicity, the thoroughness of the 5-element system really just took me. So I went to acupuncture school after that and was introduced to zero balancing there. Okay. And then was just as struck by ZB as I was acupuncture. So really grateful to now be both an acupuncturist and a zero balancer.
Nice.
Yeah.
Who founded ZB, or who kind of started that?
The founder of zero balancing is Dr. Fritz Smith. He is still alive, though retired. He's an osteopathic physician, and was, had a full osteopathic practice. And in California at the time, they were, full physicians. So he was managing a wing of a hospital at a certain point, and then went to Esalen quite a bit. And somebody had mentioned to him that there was somebody who was coming to talk about this acupuncture thing, at Esalen, and just had him come along. So he saw J.R. Worsley, this acupuncture teacher, treat somebody with acupuncture, and it just kind of blew his mind a little bit in terms of how this system could do what it did for this patient. And so he started studying acupuncture and eventually developed zero balancing as kind of a fusion of that osteopathic, structural, kind of bone-based world with the kind of energetic anatomy of the East Asian system.
Got it. Yeah, that does seem interesting because usually for acupuncture, we think about put the needle in,
Yeah.
kind of drop it in, maybe twirl it a bit, and then like step away, or you're with the patient,
Right.
but you're not doing the hands-on after the needle. You might put some more needles in, but when you were doing the ZB, I was like, this does kind of feel like osteopathic,
Yeah.
combination there.
It very much is.
Combination.
Yeah, it very much is.
So it's a combination of, it sounds like it's a body treatment, it's a mind treatment, it's an energetic treatment. How does it work if we can get into the sciencey part of it here? If there's is there some way that we can kind of theoretically or even biologically say, hey, how does ZB work?
Yeah, sure. So, it really is this fusion of Eastern and Western concepts.
Yeah.
And in the East Asian world, we kind of have these three layers of energy, these three layers of anatomy. We have the skin level, we have kind of the muscle, tissue, meridian, organ level in the middle, and then in the deepest level, we have the bones.
Okay.
And we're constantly moving energy through all of those systems back and forth, always kind of going back and forth between those three. So, from the Eastern world, we really see that zero balancing is a way to focus on the bone level energy, this really deep currents of not only our energy, but our memories, our sort of like ancestral sort of place in this world as well. Like all of that is held in the bones from that Eastern perspective. From the Western perspective, all of the bones are sort of connected by this cartilage, by the fascial network, and then, of course, all of the organs and flesh kind of is anchored on that web, that network of the bones and the fascia. And bones, fascia, and cartilage are all piezoelectric, however you say that word. So when you put pressure or traction or any kind of physical manipulation into the bones and joints, you're literally stimulating that kind of piezoelectric charge. That has been shown to have really remarkable effects on tissue change, and theoretically in our system it speaks a lot to the way where we can touch in with the major joints and bones of the body and kind of connect everything back to itself in this really nice way.
Yeah, I know that acupuncture also can affect that piezoelectric charge.
Yeah, very much through the fascial network.
The fascial network.
At the surface.
Yeah, it sounds like this is like a way to augment that treatment, or even do it alone. It sounds like you can do ZB alone with clients.
Yeah, that's exactly it. Because with acupuncture, we're working very much in this kind of organ meridian level. The emotions are in this level in that kind of theory, but. With zero balancing, we're able to kind of anchor all of that work in at a deeper level because we're connecting with the bones, we're connecting with this really deep, stable part of ourself. Very much a standalone treatment and very much augments very well for acupuncture, massage, or any other kind of, body work system. It's really, really nice for that.
And Jared, how do you decide for a patient that comes in, you're doing an intake on them, how do you decide, hey, I'm going to send, I'm going to do some ZB alone, or I'm going to do some acupuncture alone, or do a combination. I know you like to do a combo, but I'm a combo guy. I like that.
Same. Yeah, so that's my preference, and so if somebody comes in for treatment and they don't say one way or another, I'll always do that kind of combination. We'll work with acupuncture, kind of get things moving, clear some blocks away, and then anchor everything with a really nice zero balancing at the end.
Yeah.
But sometimes people will come in and... maybe they're afraid of needles, right? Some people will just pass out if they get needle, right? Tattooed people are the funniest. I've got one guy that comes in, he's got full tattoos everywhere, but he's like, no needles, man, I can't deal with it. So, so sometimes we'll decide for that reason, or other times, I might just kind of get an intuitive hit of like, oh, this person just needs to kind of drop into that level, and so we'll go straight there. But, if I have my druthers, it's a combination.
Yes, same. I like variety, and they're synergistic, really.
Yeah.
Let's kind of walk through the listener, and imagine that people. At least when I first heard of zero balancing, I always kind of was like, oh, well, maybe this is like someone meditating on a cloud, and like there's some zero gravity, and they're just floating up in space. I'm trying to balance. I don't know, maybe have a spacesuit on. If you could kind of walk through, and maybe the listener could imagine this as you're speaking, because we know that learning occurs mostly in the visual cortex. What a typical zero balancing session actually visually looks like, what someone might expect to experience during and after a session.
Sure. So let's see. Zero balancing, kind of the main way that we affect change with zero balancing is by applying what we call fulcrums. And so a fulcrum is just any kind of pressure or mobilization of the joints, right? So
your hands are on the
hands
joints,
are on the person.
or not just joints, but any kind of bone. Any
Most
section
specifically, it's foundation and semi-foundation joints of the body.
Got
So
it. Okay.
all of the vertebral
Yeah.
connections, shoulder girdles, sacroiliac joints, tarsals and carpals, but we cover the whole body.
How is that different than, now we're going to go on to the OMT question. How is ZB differ from OMT, from osteopathic manipulation?
Well, osteopathic manipulation is going to be much more sort of medically oriented. It's going to be more diagnostic. It's going to be coming from this perspective of kind of, that sort of more medical level of care.
Okay.
Zero balancing itself is non-diagnostic. And the practitioners of zero balancing who are certified are either acupuncturists, physical therapists, massage therapists, doctors, psychotherapists. There's a lot of different people, but essentially it's a non-diagnostic system. So we're not going in and saying like, oh yeah, this bone, this range of motion is only 30%. We're not having this like really deep kind of mental level interaction with the skeleton and the bones. We're kind of applying this protocol of zero balancing across the whole body. And it's this kind of rhythmic sort of pretty well set protocol. But it's not diagnostic. We're not trying to sort of fix a particular issue. We're sort of trying to treat somebody and connect them at their core with what's going on.
Connect at their core, help that person augment their own innate capacity for healing and build their terrain. Is that more?
Yeah, very much. And a lot of it too is this kind of like almost this education, because as we're sort of, well, here, I'll walk you through a typical session.
Yeah, that'd be great.
Basically, a person is lying fully clothed on a treatment table. And we start at the heels and just kind of gently pull traction through the feet. And there's this way that this traction kind of lines up the whole body, right? And then we come up to the hip bones here, the front part of the pelvis, and just press directly from there into the sacral body a little bit at the lower ribs, the lumbar, the sacrum itself. We work with the hip joints and kind of have this kind of mobilization of the hip itself through the knees. We also work with the tarsals of the feet. Then we come up to the head. We do the same thing with the cervical and the skull, the whole shoulder girdle, the upper ribs, the thoracic spine, all the way down through the arms and, into the carpals of the hands. So there's this kind of full progression through the body. And really, it's basically from the feet all the way up. And then when we close, we come from the head all the way down.
Kind of mirrors the parallel meditation.
Yeah, very much. Yeah, because the whole idea is we just kind of, it's almost this tidal way of, again, non-diagnostically going through and just balancing and reconnecting everything. And, it's this kind of back and forth thing that allows people to kind of progressively let go of tension.
Yeah.
We might be holding on to something, and if we treat it once, it might still be resistant. But if we have this kind of back and forth, and they're like, oh yeah, I guess I can, now that my sacrum is loosened up a little bit, I guess I can actually loosen up through the upper.
Yeah, I know when you were treating me, I felt like areas were getting released that were tight. I know that a lot of times we store, like you said, stress in our bodies as either tightness or some sort of dysfunction, or maybe chronic habits of posture and different things. Hips are a tight area for me, so I know that's definitely
hips and shoulders are super common for people to just hold a lot of tension in, because it's functionally they're really good places that hold a lot of tension.
They can bear that.
Yeah.
What are the most common conditions that you find zero balancing helpful for? Can anyone benefit? Can anyone just kind of go into your ZB clinic and get kind of cleaned up, straightened up?
Yeah, absolutely. So really, the answer is there's no sort of common or best thing. It's really good for everything. Because again, being non-diagnostic, we sort of just focus on treating a person at their core and really amplifying their well-being. So it doesn't matter if someone is coming in with knee pain, with back pain, maybe they're depressed, maybe they're, in here working with other practitioners for cancer or for, some kind of autoimmune, it could be anything. Because we're not treating disease, we're working with people and helping them kind of release stress.
Augment wellness.
Yeah, we're augmenting wellness. Yeah. Everything can get better.
I love the focus on the bones, because we always look at, other organ systems here, and especially in like functional medicine, integrative health, and we definitely look at the fascia. I think the bones is an area that is kind of another area of exploration that needs to be done.
Yeah, I very much agree, especially because, all of the organs are tapped into the skeleton, all of the fascia, all of the muscle, like everything is just anchored on the skeleton. And it's,
like if we improve the fascia and the organs, but then the bones are not really
right.
set correctly or something.
Yeah.
And where do you see kind of osteopathic manipulation or chiropractic fitting in? Like if you see a patient or client, like when would you say, okay, I need you to go to a chiropractor or osteopathic doctor?
Yeah, that's a great question. So a lot of times I'll refer out if people are needing some kind of, imaging, some kind of diagnostic X-ray thing that I can't provide.
Yeah.
That'll be typically, someone will come in with pain and they don't really respond, or maybe, with treatment it gets worse. It's like, yeah, okay, you should go,
or
get
red
some
flag
imaging.
symptoms. Like
Other red flags, exactly.
Unilateral numbness or tingling. They have obvious things like bowel dysfunction.
Exactly.
Or
Sudden weight loss,
right.
Et cetera. All those typical red flags.
And as an acupuncturist, as a healthcare practitioner, you're trained to identify these type of things as well. So that's how we work in integrative practice.
Yeah, very much. Yeah. And funny enough, Fritz is actually one of the first people in the medical world to have taken that list of red flags and kind of brought it into the integrative world.
That's cool.
Yeah, it's really quite neat. So we're very crisp and clear about what is our domain, and as kind of non MDs or whatever, chiropractors, osteopaths, what's not our realm to deal with.
Well, one thing we say here a lot at CH is it takes a village.
Yeah,
right?
Doesn't it?
We're so glad you're a member of the team and really helping out a lot of people. So you said there was a lot of anyone could benefit, but are there like kind of top 3, top 5, like bread and butter? Okay, these are people who would really help, get help from this.
So any kind of major joint pain, like low back pain or knee pain, shoulder pain, really, really good for that. Because we're structural in the sense that we can connect with the bones, with the tissues, and really help at that structural level.
And it's very gentle. It's
super gentle.
It's not like a high velocity amplitude.
Chiropractors have that really kind of intense.
And that could be good for some things.
Oh yeah, absolutely.
So
I love chiropractic.
Definitely refer to chiropractors, but certainly for this kind of treatment, it is more gentle, and I think this could be helpful for some people.
So it's really good for physical level ailments like that. It's also really good for kind of, for certain types of trauma, certain types of kind of mental emotional things that people are kind of closed off or kind of tightened off, where people can't kind of let go of tension, can't let themselves kind of relax more deeply. It's really, really good for helping people kind of drop in a little bit more.
So I have a couple questions there. Can someone experience a detox reaction or detox crisis from, I guess you could say that about any treatment?
Yeah, I think so. Generally, zero balancing is really safe and gentle, and we're very oriented towards not over-treating people. We're never trying to force something to move. We're never trying to force something to relax. We just connect with things and then hold space for them to move. So sometimes that does mean that people will have kind of a big reaction afterwards, Sometimes people will have memories come up, they're like, I don't know why my shoulder hurts so bad. Then all of a sudden they realize, whoa, they had this old thing that happened to them years and years ago, and that memory comes up, and there can be this kind of detox process from that.
So the trauma was stored there, and then kind of loosening that up.
Exactly. Yeah. Or sometimes people will have a lot of soreness afterwards, but then once that soreness kind of clears out, then they feel quite a bit better after. So
nice.
But people can respond any sort of way, but tends to be kind of gentle and easy.
And then the other thing I wanted to ask about was in terms of like time course or duration. How long is a session? How many sessions do you recommend for a person? It probably does vary depending on the client.
Yeah, it varies quite a bit. If somebody, regardless, when people come in, I recommend coming in for 2 or 3 treatments.
Yeah.
That gives people a sense, of kind of how to receive the session. A lot of times, especially if we have a lot of tension, people need to learn how to relax. And so it takes a session or 2 sometimes for that to happen. The sessions themselves are, 35 to 55 minutes, something like that. And we do some talking before and after to kind of integrate and kind of figure out what's needed, where do we want to go. But 2 or 3 sessions is a really good way for people to get a sense of whether this is good for them, whether this fits, whether it's helping treat the thing that they're really interested in shifting. So
I'm going to do a little soapbox moment here because our podcast. And I think that the thing about, the mind body is that, we know that a couple of centuries ago, there was a guy named Descartes, and there's this idea of the mind body split. Yeah. And a lot of times when people come to like a traditional medical practice or, what they're used to, it's kind of like, well, you have, body treatment over here and you have mind treatment over here. Like, let's analyze our labs. Let's get our body treatment, but there's not like a integration.
Yeah.
One of the pieces that I find really helpful personally and with our patients here is that, when people get some sort of body work, something where they're trying to reconnect back to the body so they can reintegrate that body, mind, spirit, their health improves.
Yeah.
And one of the key things about acupuncture and zero balancing, it sounds like, is it's really almost like reteaching that person to be mindful and aware.
Oh yeah,
of their body, of their bones, of everything.
Yeah, that's really a perfect way to say it, because the way trauma and held tension work best is to be able to store them away from consciousness while we kind of move through the world, right? So we can be functional, we can get up and go to work, we can take care of the kid, whatever it is, and we sort of put them in places and so
put it in a little extra storage closet kind of place.
Exactly. And so there can be this way of we touch in with a part of the body where somebody's holding tension, and it suddenly connects to them, like, oh my gosh, like I've been sad for years because my mom passed away, or because of this, and they've just been holding on to it. And it's not until they get this sort of space to connect with that and really feel where that emotion is and how that connects to the rest of the body, and then things can really open up. But yeah, zero balancing is a remarkable system for its ability to kind of link up mind and body and spirit all together.
And I think to optimize someone's wellness and ability to, heal, and ability to kind of step into their full power, not that we're going to say this is going to treat disease, because we can't say that, but we can say that, I would say that, if it can lead to reducing stress or releasing some stored, tension or stress, we know that stress is a major cause, major driver of disease.
Absolutely. I was thinking, as you said that, about, I've been seeing recently a lot of patients who are like really large people, very tall, very broad, just kind of big people in general. And I've been noticing a lot how typically people that show up really big in society will try to make themselves smaller. Because it's just easier, you don't intimidate people as much, or, there's this way where you can sort of like not take up too much space. And there's this way, like, that is a thing that causes stress, and if that heightens cortisol, if that causes literal stress to the bones, like all of those things have profound downstream effects, whether you think about arthritis from decades of held tension, or, the stress hormones, cortisol or whatever, just kind of coursing through a person's body, like as they try to hide.
That's a rabbit hole about how society tends to pigeonhole people into various, what is an acceptable body size, or those type of things.
Exactly, yeah. And so that's a beautiful thing about ZB, is we're able to go in and just treat each person as a very individual person and find out where they're holding stress, and ultimately really invite them to inhabit their body fully.
Yeah.
Instead of kind of hiding places or sort of shirking away from parts of themselves, it's like, oh, I can actually stand up really tall and be myself,
Yeah. And then also in an era of Zoom, right? We're in the era of Zoom now.
Yeah.
From Zoom to ZB, there's another Z in town now. Because, touch is healing. We know that touch stimulates oxytocin. We know that's super helpful. A hormone that helps to regenerate the body is involved with like happiness and all this stuff.
Yeah.
Right? If you hug someone or touch someone, and a lot of times we've lost that in this society.
Yeah, it was actually, we just had a training about what is it, the Younger You system?
Yes.
And they were talking
Dr.
about
Kara.
that. How, a lack of social connection and a lack of really quality touch is actually profoundly damaging to people's chromosomes. It's damaging to their genetic.
People need that ancestrally. I think that kind of creates a cell danger response in a way if people are not touched enough. Yeah.
That makes sense. Yeah. And so zero balancing, because it is a therapeutic clinical practice, it's very safe, it's very contained. But at the same time, we don't typically get, all the places we touch in a zero balancing session, we don't typically get touched. Even if we have a really nice hug, someone's not sort of like holding L4 and L5 and really anchoring into that, So we're able to kind of touch people in this really safe, contained way, but in a way that's very comprehensive.
Yeah.
And it's remarkable how much people need that, especially in the age of Zoom, when we're all just kind of hunched over and by ourselves. And
So you said there's different practitioners that typically are ZB practitioners. So who can learn ZB? Can anyone learn? Do you have to be a practitioner of some sort?
Yeah, that's a great question. Anyone can learn zero balancing, and there's certain things about the zero balancing theory that I think everybody should learn, and really, frankly, I think everyone needs to learn.
So we'll put it in the schools.
Say again?
We'll put it in the schools.
Yeah, ideally, right? I mean, really, how to touch people thoughtfully, how to be good about boundaries, how to be crisp and clear about boundaries. But yeah, so anyone can learn. To be able to practice, you need to have some kind of umbrella licensure that allows you to have touch, to be able to apply touch, whether it's acupuncture, physical therapy, MD, any of the other sort of, licenses that allow for touch.
Massage therapy.
Exactly, massage therapy.
Yeah, got it.
But yeah, there's a lot of people in ZB classes. I joined the faculty of Zero Balancing last year, and we see a lot of people come through who are just they just want to they've always been good with their hands and they want to learn how to touch and give massage to their family better. Or they're just kind of curious about natural healing and something about zero balancing struck them. Yeah, there's absolutely people like that who come to ZB classes.
So they can do it for themselves or loved ones. Things.
Yeah, absolutely.
That's great. And then for listeners who are interested in trying zero balancing for themselves, what advice would you offer for finding a qualified practitioner? How do you find someone that's certified in this? How do you get the most out of your sessions as a patient?
Yeah, so Zero Balancing is an organization that's, each country has its own zero balancing organization that has set one up, that is. So there's one here in the United States, there's one in New Zealand, there's one in Switzerland, there's ZB organizations across the world. But if you go to zerobalancing.com, you can find a practitioner just sort of anywhere, by zip code, by city.
Great.
So that's a great way to go and look for a practitioner.
So it's all around the world.
It's all around the world for sure.
That's awesome.
Yeah, it really is.
Let's kind of tie it up with, let's say listeners out there kind of like, I want to learn a little zero balancing right now. Is there something that they can do kind of off the top that you could kind of share with them?
Yeah, absolutely. So we use a particular quality of touch in zero balancing when we do these fulcrums that we call interface.
Okay.
And interface is really about being clear on the boundary between things, right? And so, if I am touching my own fingertips, I can get really clear about, my right hand is my right hand, my left is my left. And I kind of keep my mind on differentiating those the whole time, right? Or if I'm touching this table, or if you have your hand out here, if you put your hand on the table, I can sort of be really clear about I'm me. And even though I'm touching you, I'm really clear about where your structure is, where your energy is at. That's different than kind of blending, so if you are like holding hands with your partner or, holding a child or something like that, there's this kind of blending thing that is lovely, but it's just different. And so for people at home, you can find your collarbones and just kind of lightly touch, so you're just barely on the skin. And, the bone is right there, but you're not really touching the bone, you're touching the skin, right? And then get clear about that sort of interface quality and put a little more pressure in until you feel like you're connecting with the collarbone itself. Yeah, so you have a little bit of a breath, I have a little bit of a breath. Suddenly I can feel like my pulse a little bit deeper in my body. I can feel this kind of referred energetic connection from my collarbones down into my ribs a little bit and into my back of my neck. Yeah, we have bigger breaths because there's this kind of integrating, kind of working breath. We're helping to kind of like, we're reconnecting.
I almost think breath work is essential for actually doing this.
It correctly. Is, yeah. And the funny thing is, we look for working signs during a session where we can see that they're processing this work, that something is happening.
Yeah.
So sometimes the eyes will flutter in this kind of REM way, or their head might kind of loll off to the side, or they have this really big breath. And the breath is an essential way that all of this work is kind of integrated.
Yeah, I felt like if I didn't do that, I wouldn't really been able to concentrate and really fully get into it.
Absolutely, yeah. The breath helps to kind of carry all that energy that we connected with here, helps to carry it back into the rest of the system.
Right, so it's not just stuck in one area.
Yeah.
That's the beauty of that. The body's connected, and working on one section of the body, even though you're looking, down, up, down, it's really the whole body's connected.
Very much. Yeah. So at home, if you're feeling a little tender, a little sore somewhere, you can just apply that kind of interface touch whether it's here at the collarbone, down here at the elbow itself, if you want to just do that with your hand, or your shins is another nice way to do that. Yeah, you can sort of apply that quality of touch to any part of your body.
I noticed when I was doing this, and it kind of reminded me of a Qigong ball.
Yeah.
But my left side is tighter, and I could almost feel it. You start to feel it in the shoulder, even when you do that light touch. It's really interesting how that teaches you so much about your body.
Very much, and that's the whole quality of the interface touch, because if you're there at interface, you have to pay attention of what is what.
Yeah.
And be clear about, I'm here and they're there, and then you start to realize, my shoulder is,
yeah,
or like, I'm hunched over, maybe I could actually straighten my spine up a little bit, and that feels better. Yeah. So the whole thing is really just an education, not only for the person receiving, but especially for me when I'm giving a session. It's always education.
And the straightening of the feet, I remember you doing that, and the hips. What I also noticed was that the energy flow kind of got unblocked. How you have the blood vessels, the arteries, the veins, the lymph system, the nervous system, like everything is kind of flowing. But if those highways are blocked, then there can be potentially discomfort or even disease or different things.
Yeah, absolutely. Yeah, we say we work a lot with structure and energy in zero balancing, and someone can have a really good structure, all their skeleton, like everything is perfectly fine, but they have pain because the energy isn't moving well through it. Or they can have a structure, maybe they have really severe scoliosis, or whatever it might be. Maybe their structure is kind of not balanced, but the energy moves through it fine, so they're good. They don't have any pain. So it's always about finding where the structure and the energy are kind of moving together, and how to move most efficiently with both.
Yeah, and there's a structure to the fascia and to the capillaries and things that we wouldn't necessarily be able to see on an X-ray.
Yeah,
that's where I think there's that macrostructure and microstructure.
Absolutely. Yeah, you see combined. That with chiropractic stuff too. It's like, if you're blocked up in this vertebrae, if there's inflammation, if there's some kind of subluxation, and you kind of straighten that up, all of that nerve flow, all of the blood, all of the energy downstream is sort of opened. And
it's hard to say this as a functional medicine practitioner, but I will say this, is that labs and imaging don't tell us everything.
Yeah,
we can't see everything that's real.
Yeah.
A lot of the things that are happening in the body are microscopic. They're dynamic. They're interfacing with different, organ systems, and they're constantly changing. And that's where I think a talented practitioner like yourself that can assess that energy can be really, really helpful.
Yeah, sure. Because, you might see high cortisol levels on a lab, right? But where is that coming from? If you're touching a person's collarbones and, realize that, they broke their collarbone when they were 5, they suddenly have this memory come up and they have this big release of energy, that you're touching stress.
Getting to
you're
the root cause there.
Yeah.
Awesome. Well, thank you so much, Jared, for talking to us about ZB. I'm going to say that for the rest of the year, from Zoom to zero balancing. So I'm going to go from there. Any resources to learn more? I think you mentioned some national or international sites maybe where people could learn more about ZB, find a practitioner, etc.
Yeah, absolutely. Yeah, zerobalancing.com. You can go on and find a practitioner. You can also go on and find courses. So people are often offering courses all across the world. Here in the States, quite a bit.
And you offer?
Yeah, courses? I offer as well. I'll have some courses coming up in Silver Spring and College Park later this year.
How do we find out about those?
Yeah, zerobalancing.com.
Okay, and it'll be on there.
Yeah, for sure.
College Park, great.
Yeah, you can search classes that are being taught in particular areas, or just get an overview of everything. Or you can stay tuned to CIH. I'm sure I'll be, putting some information through CIH about classes coming up.
Definitely do that.
Cool.
Jared, what is one thing you wish everyone knew about zero balancing, just kind of wrapping that up today?
That it feels amazing.
Yeah.
Each session is unique and different, but zero balancing always just has this kind of grounding way of kind of helping us let go of tension we don't need. And
so here you typically do tie it in with acupuncture and with kind of needle-based, but then sometimes if people don't, like you said earlier, if someone doesn't have really a proclivity towards having needles in, you could do the kind of touch, but not with the needles.
Exactly. Yeah.
Awesome. Well, Jared, we have a fun closing question for you. Thank you so much for coming on today. Part of our mission at CH is to make integrative healthcare more accessible and focusing on the small steps that we can all take to improve our health. So we'd love to hear from you personally. What is one thing under $20 that you feel has transformed your health?
Yeah, great question. The answer that I've come up with is a hori hori. Do you know hori horis?
No.
So you know that I'm also a plant and
Yes,
sort of gardening
yes.
wild food nerd. So a hori hori
Yes,
is
you're an expert in that.
it's a Japanese style kind of digging knife.
Okay.
And so it's almost like a trowel, but it has a knife on one side, it has a saw blade on the other, and it's very, very sturdy.
Okay.
So you can find one of these for under $20, but
Nice.
it's absolutely transformational in terms of going out in the woods and being able to harvest things.
Okay.
Getting branches, digging up roots and stuff like
So
that.
they're at Home Depot and things, or
you
where
might
would
be
you
able to
them?
find them at Home Depot for sure, at a gardening store.
Yeah.
Or,
Okay.
or online gardening stores
Yeah.
as well.
Hori hori.
Hori
How do
hori,
you spell that?
H-O-R-I,
Okay.
H-O-R-I.
All right.
Yeah, and if you come on a plant walk, I'll have mine, and we'll be digging up some roots.
Awesome. Yeah. Looking forward to that. Well, thanks so much, Jared, for coming on today.
Thanks so much for having me.
Thank you so much for joining us today for this episode of the Capital Integrative Health Podcast. A quick reminder that the information we share in this podcast is meant for educational and informational purposes only. It's not a substitute for professional medical advice, diagnosis, or treatment. We highly recommend that you speak to a qualified healthcare provider before making any medical or healthcare decisions. If you enjoyed this episode, please take a few moments to subscribe and leave us a review. Your reviews help us reach more people and continue to offer innovative insights and information to better optimize your health and wellness.